Ella, good morning.
Good morning.
Hello. Oo, ma'am, medyo tight din ka.
Good morning, everyone. This meeting is now called to order. I would like to call first Ma'am Sylvia to lead us on prayer. Ma'am Sylvia.
Yes, ma'am. In the name of the Father, the Son, and the Holy Spirit. Almighty Father, we thank you that you hear and answer our prayers. Hear us today, Lord, and be in the midst of our meeting. Thank you for the presence that comes our troubled sea of life and speaks peace to our souls. Give us clear minds and peaceful hearts as we gather together to do our task. Bless us, dear Lord, especially our resource persons and guests. May we live in the light of your salvation, experiencing the freedom that is in you. Through Jesus Christ, our Lord. Amen.
We'll now proceed to the calling of the roll. May I hear a motion? Kong
Madam
Gil?
Chair, I move to dispense the calling of the roll.
Okay, thank you, Kong Kaloy. There's a motion to dispense the calling of the roll, duly seconded. Is there any objection? Hearing none, the motion is approved. Again, magandang umaga po sa ating lahat. Exactly a week ago, this committee heard a resolution on the apparent confusion brought about by the issuances of PhilHealth on the availment of COVID-19 related benefit packages. As a result, we asked the PhilHealth to reconsider its retroactive circular on the benefits packages for probable and confirmed COVID-19 patients. Today, PhilHealth leadership is back, together with the Department of Health and key agencies of government and the private sector, to give us a briefing, number one, on the updates regarding the implementation of RA 11223, otherwise known as UHC Act, and number two, PhilHealth Circular 2021-0013 regarding the temporary suspension of payment of claims or TSPC. Allow me to give a quick backdrop to these topics in our agenda. The UHC law was enacted with Sustainable Development Goals and their targets by 2030 in mind. SDG 3 in particular seeks to ensure healthy lives and promote well-being for all at all ages. SDG 3 recognizes that a unifying platform for making progress on health is needed, and that is the UHC. SDG 3.8 specifically states that the goal of achieving universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. The promise of UHC is simply the universality of health and coverage. Simply put, UHC promises to leave no one behind, a promise that is often fraught with difficulties. This means providing a comprehensive set of quality and cost-effective, promotive, preventive, curative, rehabilitative, and palliative health services. And this is the universality of health, and without causing financial hardship. To minimize as much as possible out-of-pocket expenses, especially for indigents and marginalized individuals, the law provides that every Filipino citizen shall be automatically included into the NHIP, and this is the universality of coverage. Prior to the implementation of the mandated 100% coverage of PhilHealth, the National Health Insurance Program already covers 92% of the entire Philippine population. The PSA recently announced that based on 2020 census of population and housing, the total population of the Philippines as of May 1, 2020 is at 109,035,343. To target the remaining population that have not yet been covered by health insurance program, premiums of indigent patients, specifically those in the poor category or C3 and D category, will be paid for by the government. The government will now have to address the gaps in coverage of both financially capable and financially incapable Filipinos to ensure 100% availment rate of health insurance coverage with special interest in covering the poor. Following the 5 pillars of UHC, namely governance, financing, health, human resources, service delivery, and regulation, the law is expected to deliver the institutionalization of HTA, or Health Technology Assessment, and HTAC, as well as the strengthening of the health literacy efforts and implementation of health promotion programs. No co-payments in basic or ward accommodation and benefits entitlement, generation, recruitment, retraining, regulation, retention, and reassessment of health workforce based on population needs, and contracting of province-wide and city-wide health systems, as well as the primary care provider network, ensuring safety, quality, affordability, and equitability or equitable health services, such as those that will require the setting of standards for clinical care through the development and use of clinical practice guidelines, and requiring healthcare providers to make price information of health goods and services to be readily accessible. And finally, the facilitation of equitable distribution of health services and benefits that will prioritize geographically isolated and disadvantaged areas. The question before us now is what had been done more than 2 years after the law came into effect. Are we going to hear at least little but nonetheless consequential health gains, or worse, the perils of a journey that not a few of us had anticipated from the start? This committee appreciates the presence of DOH, PhilHealth, and other resource persons here today, and we hope that you can give us the latest updates on the implementation of UHC law, particularly kung ano ba ang nagawa ng UHC law para sa mga Pilipino. Ano ba ang pakinabang ni Juana at Juan sa batas na ito, lalo na sa harap ng pandemya? At ano ba ang iniintay natin pakinabang mula sa pagpapatupad ng batas na ito? As chairperson of this committee and one of the principal authors of UHC law, I would have wanted to devote a large chunk of our time on the updates, but I am afraid that this committee will have to spend so much of the time for a dialogue between PhilHealth and hospital groups over the issue of PhilHealth circular on temporary suspension of payment claims. PhilHealth says this serves as preventive measures against healthcare providers that are subject to investigation. The Philippine Hospital Association, Private Hospital Association of the Philippines, or PHAPI, and PMA, or Philippine Medical Association, on the other hand, are basically saying ayaw na. They declared that they are disengaging. They were disengaging with PhilHealth and warned that the bridge between them and the PhilHealth is bound to collapse. Gusto ko lang po sanang manawagan, at gagawin ko po ito hindi lamang bilang miyembro ng Kongreso at tagapanguna ng committee ito, but higit sa lahat bilang Pilipino. Kung maaari po ay liwanagin natin ng mabuti, makinig tayo sa paliwanag ng bawat isa at magtulungan po tayo. Isipin po sana natin at unahin higit sa lahat ang kapakanan ng ating mga mamamayan na sa gitna ng matinding panganib na dulot ng pandemya. Perhaps PhilHealth can walk us through on the rationale of this circular, especially on its impact on the hospitals and healthcare institutions or providers and in the delivery of health services, while the hospital groups can tell us what they see as the possible repercussions of the circular and what compromise can be made so we can move on to address the more pressing concerns of delivering health services to public amid COVID-19 health crisis. Maraming salamat po sa inyong lahat. I would like to recognize first the presence of the following members. We have our Vice Chairperson, Representative Marilu Arroyo, Deputy Speaker B.H. Herrera D. or Bernadette Herrera D. Deputy Minority Representative Carlos Zarate, Representative Stella Kimbo, Representative King Swansing, Rep. Sara Ilago, Representative Adrian Ebcas, Representative Edgar Sarmiento, Representative Lucille Nava, Representative Alfred de los Santos, Representative Rodolfo Ompong Ordonez, our Vice Chair, Representative Maricel Nagaño, Representative Alan Ecleo, Representative Princess Rehan Sakaluran, Representative or Deputy Speaker Vilma Santos, Representative Dalia Santos, Representative Maria Lucille Nava, Representative Irene Salog, our Vice Chair, Representative Jerry Boy Spina Jr., Representative June Babasa, our Vice Chair also, Representative June Gato Jr., and Representative Arhel Kabatbat. May I ask Ma'am Sylvia to kindly read or recognize the presence of our resource persons. Ma'am Sylvia.
Yes, ma'am. For today's hearing, we have from the PhilHealth PCEO President Attorney Dante Gueran. We also have COO Attorney Eli Dino Santos. We have CIO Dr. Arturo Alcantara. We have ASVP Nerissa Santiago. We also have ASVP Attorney Maria Emily Roque. We have ASVP Attorney Angel Miranda. We have SVP Attorney Jose Marie Tolentino. We have AVP Lemuel Untalan, Dr. Lambert David, Dr. Bernadette Lico, SVP Attorney Jose Marie Tolentino, AVP Lemuel Untalan. We also have Francis Ray Remigio. From the DOH, we have Secretary Francisco Duque III. We also have Yusek Mario C. Villaverde, Yusek Mirna C. Capotaje, Yusek Roger P. Tongan, Yusek Abdullah B. Dumama Jr., Yusek Lilibet C. David, Asek Kenneth G. Ronquillo, Director Maria Teresa G. Vera, Director Irma L. Asuncion, Director Nicolas B. Lutero III, Director Leonita P. Gorgolion, OIC Director Francis Rose Elgo Mamaril, OIC Director Pretchel P. Tolentino, OIC Director Rodolfo L. Albornoz, and ASEC Francie Laksamana. From the Department of Finance, we have Roslyn Salagoste and PLLO Job Desmonte. From the DBM, we have OIC Director Gina Brillantes, Mr. John Castillo, the Division Chief, and Ms. Mary Queenie Tamayo. From the World Health Organization, we have the WHO representative to the Philippines, Dr. Rabindra Apeya Singhe. From the PAGCOR, we have AVP Sharon Quintanilla, Mean Vitu Anthony Santos, and Mr. Thibaut Villaflor. From the IHAPI, we have President himself, Dr. Jose De Grano, Dr. Arturo Flores, Director. From the PHA, we have Dr. Jaime Almora, the President. And from the PMA, we have Dr. Benito Atienza, President. That's all, Your Honor.
Thank you, Ma'am Sylvia. We'll now proceed on agenda number 4, which is the a briefing of the Department of Health and PhilHealth on the updates regarding the implementation of RA 1123. So I would like to recognize now the Secretary of Health, Secretary Duque.
Good morning, Madam Chairman.
Check.
Yes, good morning, Committee on Health Chairperson, Representative Angelina, Helen, D.L. Tan, the honorable representatives, members of your committee, my DOH family, as well as PhilHealth family, colleagues in service, a pleasant morning to all. At this point in time, it is undeniable that universal healthcare, COVID response, and health systems resiliency are heavily intertwined facets of public health. The defining UHC characteristics of comprehensive membership, rational financial investments, and quality primary care services are the very same principles that transcended our COVID-19 efforts and shaped the future landscape, not just for health, but also for society as a whole. Over the past year and a half, the DOH and PhilHealth have developed more than 60 policy issuances to guide our UHC implementation, spanning the primary care benefit package to the service delivery design of healthcare provider networks. On top of this, our efforts to address the pandemic thus far allowed certain aspects of the UHC implementation to be fast-tracked, such as strengthening of our epidemiologic and surveillance systems and health emergency responses, streamlining of procurement and supply chain management systems, intensifying health promotion campaigns, capitalizing health system capacity investments, capacitating health decision-making at the local levels, and integrating health information technologies, as well as the adoption of telemedicine, in particular, as an important service delivery platform at this time. Your Honors, several UHC capacity building initiatives, including the launch and rollout of the UHC e-modules, have been rolled out to equip our implementers with the proper knowledge and tools for implementation at the local level. We remain staunch partners of our LGUs in building healthier communities. And so we lend our technical expertise to train up our LGUs and create tailor-fit local plans, especially as a reflection of the new mandate for the devolution of health. Parallel to our LGU capacity building activities, we also give special focus and support to the development of our healthcare workers. The recently released National Human Resources for Health Master Plan serves as the blueprint to ensure the sustainable production, equitable distribution, and continuous development of compassionate and responsive human resource for health to deliver healthcare at all levels. This master plan also highlights the welfare, protection, and career development of our human resources for health to optimize and strengthen our health workforce. And as we aim to address the supply end of our HRH, we also endeavor to meet the demand end. Thus, the DOH has also set the National Health Workforce Support System. The support system has guided us in the deployment of our Scholar HRH to geographically isolated and disadvantaged areas, or GIDA areas, allowing us to augment the workforce in areas of great need. As of June this year, 100% of GIDAs were provided with HRH augmentation for a total of 13,853 physicians, nurses, and midwives deployed in 978 municipalities with GIDA barangays. And we hope to be continually responsive to the needs of our people, particularly in underserved areas. Aside from this, primary care worker certification is underway. During this transition period, DOH has been issuing provisional certification to select health professionals who are working in primary care facilities upon their registration to the National Registry for Primary Care Workers and completion of the Primary Care Worker Orientation course. As of this month, 5,122 health professionals have registered in the National Registry of Primary Care Workers, and approximately half of our UHC integration sites have at least one certified primary care worker. Through this all, we have been and continuously are grateful and indeed very fortunate to have the many passionate people in public health and its adjacent sectors who have contributed to make this happen. In fact, we have witnessed greater demand and appreciation for intersectoral collaboration and multi-level sectoral engagements for health. Circumstances have proven that health is not only a matter of concern for our sector, but of the whole government and the whole nation. Our joint resourcefulness and shared determination in the face of these trying times are our greatest tools to unifying these efforts and successfully realizing UHC. As such, and finally, we are eager to participate in today's dialogues. We believe that this hearing will also be an important avenue for the DOH and PhilHealth to refine their plans as we anticipate the budget deliberations for the next fiscal year. We give the committee our assurances of our unwavering dedication to our shared UHC vision. Thank you very much, and we look forward to our fruitful discussions this day. Maraming salamat po muli sa ngalan ng DOH and PhilHealth.
Thank you, Secretary Duque. So, sino po magpe-present? Do we have...
Madam Chair.
Kong Edgar, we'll finish first the presentation.
Madam Chair, this is very important, Madam Chair. I'm hoping the Chair will consider because this has relevance to the committee hearing. The Secretary failed to mention very important specific number, Madam Chair. I think with the permission, with the wisdom of the Chair. This is relevance to the discussion, Madam Chair. This was never mentioned by the Secretary, good Secretary. I'm hoping that we can have the number, specific number. Very important question, Madam Chair.
Okay. Kong Edgar,
Madam Chair,
I think another
yes,
one
yes.
will, another personality from the DOH will present the updates, the specific updates. So
I'm hoping this will be answered, Madam Chair, because the good Secretary failed to mention in support to our universal health care specific information, Madam Chair, which we wanted to know from the very start.
Kong Edgar, if we can proceed first doon sa presentation of the assigned member ng
I yield to the ruling
Yeah.
of the Chair. However, the specific question I wanted to raise, Madam Chair, is I just wanted to know the number of partners of hospitals we have in the country.
Okay.
That's
We'll
very
ask them
important,
later
Madam
on,
Chair.
yes.
And
We'll ask them later on.
thank you, Madam
Okay,
Chair.
thank you, Kong Edgar.
Because this is relevance again to the direction. Thank you, Madam Chair.
Yes,
I yield to
thank
the
you,
Chair.
thank you.
Maraming salamat po.
Yes. Is there anyone from PhilHealth, Attorney Garan, opening remarks or statement?